Over the last 24 hours, we have identified 399 new cases of COVID-19 and completed about 10,400 tests. Our positivity rate currently stands at about 3.7%. We have identified 47 new cases of a variant of concern. This means that 734 of these cases have been identified since the first variant of concern was detected from a test sample from a returning traveller on December 15th. While any cases of a variant of concern are worrying, so far we have been able to slow the growth of these cases here in Alberta. In the past 6 weeks, the percentage of all of our cases has risen somewhat, from about 3% of all active cases in late January to about 9% of active cases today. Having said that, in other jurisdictions, they have seen a much more rapid growth of variants of concern as a proportion of all COVID cases, going from 3 to 4% to well over half of all cases in just 6 weeks. This means that our health measures, both the overall restrictions as well as the targeted measures for variant cases, are working to slow the growth, and if we continue to work together, we can continue to limit the spread. Looking to schools, there are active alerts or outbreaks in 259 schools, or about 11% of schools in the province. These schools have a combined total of 1,017 cases. There are 254 people in hospital, including 37 in ICU. Sadly, 2 new deaths were reported to Alberta Health in the last 24 hours. This leaves 2 more families grieving their loved ones, and my sympathies go out to them. My thoughts also go out to those who are in hospital or ICU, and to the families who are watching their loved ones battle this virus. To date, we have administered close to 309,000 doses of vaccine in our province. This includes more than 91,000 Albertans who have been fully immunized with 2 doses. I'm pleased to report that so far, close to 138,000 Albertans over the age of 75 not residing in continuing care or designated supportive living have been vaccinated or have appointments to be vaccinated. This is great news, and will go a long way in protecting those who are most vulnerable to severe outcomes from this virus. Today, we opened up appointments for the AstraZeneca vaccine to Albertans born in 1957 and First Nations, Métis or Inuit individuals born in 1972. As we anticipated, AHS has experienced high demand for appointment booking since launch at 8 o'clock this morning. As of 2:30 p.m., more than 11,500 eligible individuals have already booked their AstraZeneca appointments, including 1,800 through 811. Immunization appointments continue to be available in all AHS zones. As you know, we're receiving 58,000 doses of this vaccine this week, and booking is rolling out 1 birth year at a time. Beginning tomorrow at 8 a.m., we will open up AstraZeneca appointments to Albertans born in 1958 via the AHS online booking tool and HealthLink. First Nations, Métis or Inuit individuals born in 1973 will also be able to book via 811. Individuals who were eligible today will retain their eligibility, and we will be adding this additional birth year so that it will be 2 years eligible tomorrow. We will continue booking eligible Albertans as AstraZeneca supply allows. We anticipate demand and 811 call volume will remain high in the coming days. If you can, we recommend that you book online. You can also try booking during off-peak hours to avoid the rush. I want to be clear that the AstraZeneca vaccine is not unsafe for individuals who have chronic conditions. We wanted to be able to offer those individuals the Pfizer or Moderna vaccine based on the NACI recommendations, and those individuals will be eligible, we anticipate, in early April. But if an individual who has a chronic condition wishes to receive AstraZeneca and they're in the appropriate age group, they could choose to do so. There is no requirement to prove that an individual is healthy if they wish to receive AstraZeneca vaccine, and again, they are in the eligible age group. We know that a little over half of the doses we received need to be used by April 2nd, and the rest of the doses that we received do have a longer expiry date. And with the uptake we've seen in this first stage group, if that continues, I believe that we will have no issue being able to provide that vaccine to Albertans who want it well before the April 2nd date of that, again, slightly more than half of the doses. And we do have that longer time interval for the other batch. With respect to whether or not Albertans might be waiting for an mRNA vaccine, the Pfizer or the Moderna, it's difficult to say. I do think that we have good evidence, certainly real-world evidence out of the UK, that the AstraZeneca vaccine is effective at preventing severe outcomes in the individual who receives it. So I would encourage Albertans who are eligible for a vaccine to, again, look at the options and then choose the vaccine that they're able to get as soon as they can. And again, there may be some who only have to wait a few weeks for the Moderna or Pfizer and wish to wait, but others who may have to wait several months. The AstraZeneca vaccine does provide that protection for those 2 months with, otherwise they would have had to wait.